Imagine this, Reena, a 35-year-old working mom in Kolkata. Every morning, she rushes to get her son ready for school, skips breakfast, and survives on a cup of tea. She ignores her body's signal to use the washroom. "I'll go later," she says. Days pass, but her bowel movements become less frequent, harder, and painful. Reena doesn't realize it yet. She's facing a silent, uncomfortable, but very common problem: constipation. So in this video, we'll understand everything about constipation, what it really means, how it happens, what symptoms to watch out for, and most importantly, how to treat and prevent it naturally. You'll learn the simple lifestyle changes that can make a huge difference, from what you eat, how much water you drink, to how you manage stress and daily habits. By the end of this video, you'll know exactly how to help your digestion run smoothly again, just like Reena did. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, Medicine Specialist, Diabetes, and Hormone Specialist. Information has been collected from Mayo Clinic, Cleveland Clinic, and patient.info. Before we continue, don't forget to subscribe to this channel for clear, science-based explanations that make complex health topics easy to understand. What is constipation? Constipation isn't just about not going every day. Doctors define it as having fewer than 3 bowel movements a week or passing hard, dry stools that are difficult to push out. According to the Mayo Clinic, it's not only the frequency that matters, it's also about the effort, the consistency, and the discomfort you feel while passing stool. It can happen to anyone: children, adults, or the elderly. Sometimes it lasts a few days, but when it continues for weeks or months, it becomes chronic constipation, which can deeply affect your quality of life. Common symptoms. Reena starts noticing that her stomach feels heavy and bloated. She sits in the washroom for long minutes, yet feels incomplete relief. Here's what most people experience: passing stool less than 3 times a week, hard, lumpy, or dry stools, pain or straining during bowel movement, a feeling of incomplete emptying, bloating, gas, or abdominal discomfort. And when constipation becomes severe, slight bleeding or pain may occur from straining too much. These are signs that your body is asking for help. Why does constipation happen? So, what exactly leads to this problem? The Mayo Clinic and patient.info identify several common causes: low-fiber diet, too much refined food, like white rice, bread, pastries, and not enough fruits, vegetables, or whole grains, not drinking enough water, dehydration hardens the stool, lack of exercise, inactive lifestyle slows digestion, ignoring the urge, regularly postponing bowel movements confuses the bowel's natural rhythm. Certain medicines, iron tablets, strong painkillers, and antidepressants can cause constipation. Medical conditions, diabetes, thyroid imbalance, and pelvic floor issues also play a role. In Reena's case, it was her rushed mornings, stress, and low-fiber diet that triggered her symptoms. Who is at higher risk? Some people are naturally more prone to constipation. Patient.info notes the risk increases with aging, because the digestive system slows down. Women, especially during pregnancy or hormonal changes, lack of physical activity or long sitting hours, low-fiber diet and inadequate water intake, anxiety, stress, or depression. Certain medications like opioids or iron supplements. If you're over 60, have limited mobility, or sit long hours for work, it's time to be extra cautious. How to manage and treat constipation. When Reena finally visited her doctor, she learned that most cases don't need strong medicine. They just need strong habits. Here's what the doctor advised. Eat more fiber. Include fruits like papaya, guava, apples, vegetables, lentils, and whole grains. Increase fiber gradually. Too much too soon can cause gas or bloating. Drink more water. Aim for 8-10 glasses a day. Avoid too much caffeine, which can dehydrate the body. Exercise regularly. Even a 30-minute brisk walk helps stimulate bowel movement naturally. Follow a toilet routine. Go at the same time daily, preferably after meals. Never ignore the natural urge. The longer stool stays inside, the harder it becomes. If these changes don't help, doctors may prescribe fiber supplements, stool softeners, or mild laxatives, but always under medical supervision. For people with chronic constipation caused by pelvic floor dysfunction, a therapy called biofeedback helps retrain the bowel muscles. How to prevent constipation? Experts from Cleveland Clinic and Mayo Clinic say prevention is always better than cure. Simple daily habits can make all the difference. Include natural laxative foods like prunes, papaya, flax seeds, or soaked raisins. Maintain a consistent eating and sleeping schedule. Limit processed foods, fried snacks, and refined carbs. Manage stress through yoga, meditation, or relaxation techniques. Most importantly, never hold stool when you feel the urge. Respond promptly. Healthy habits formed early can save you from years of digestive distress later. Rena's turnaround. After understanding her problem, Rena made a few small but powerful changes. She started her morning with warm water and fruits, took short walks during office breaks, and created a fixed toilet routine. In just a few weeks, she began feeling lighter, her bloating reduced, and her energy came back. Constipation was no longer a daily battle because she listened to her body. Final thoughts. Constipation isn't just about the gut. It's a reflection of your entire lifestyle. It's your body's way of saying, I need water, movement, rest, and attention. Even though it's common, it's not something to ignore. If constipation lasts more than a few weeks, always consult your doctor. With the right habits, you can restore balance, naturally. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK. Medicine Specialist, Diabetes and Hormone Specialist. Information collected from Mayo Clinic, Cleveland Clinic, and Patient Info. If you found this video helpful, subscribe to this channel, share it with friends, and help spread awareness, because health begins with understanding your body.